Let's get something out of the way first. This video is not here to scare you. Fear doesn't save lives. Knowledge does. And the reality about pancreatic cancer is brutally simple. When it's caught early, survival rates improve dramatically. When it's caught late, and it usually is caught late, the numbers become grim. Pancreatic cancer is the third leading cause of cancer-related death in the United States. More than 57,000 Americans are diagnosed with it every year, and the vast majority of those diagnoses happen in people over the age of 60. The median age at diagnosis sits right around 70, so this is, statistically and medically, a disease that disproportionately targets seniors. Now here's the cruel part. The pancreas is a small, wedge-shaped organ tucked deep behind your stomach, nestled against your spine. You can't feel it from the outside. There's no simple screening test for it the way there is for breast cancer or colon cancer. It doesn't show up on routine blood work until it's already advanced, which means the burden of early detection falls in large part on you, on recognizing what your own body is trying to tell you. That's exactly why we made this video. Each of the 8 signs we're about to cover has been documented in peer-reviewed medical literature as an early indicator. None of them, on their own, guarantee cancer. Many of them have perfectly benign explanations. But when you know what to look for, you give yourself the single most valuable thing in oncology: time. Let's begin. Sign number 1. Unexplained weight loss. Margaret, 72, from outside Philadelphia, lost 11 pounds in about 6 weeks. She hadn't changed her diet. She wasn't exercising more. Her daughter noticed it first, said her blouses were hanging loose around the shoulders, that her collarbone looked sharper. Margaret figured stress was the culprit. She'd been dealing with a leak in her basement, some insurance headaches. Bodies lose weight under stress, she told herself. Perfectly normal. It wasn't stress. Unexplained weight loss is one of the most common early presentations of pancreatic cancer, appearing in roughly 60 to 80% of patients at the time of diagnosis. The mechanism works like this. The pancreas produces enzymes that help your body break down and absorb nutrients from food. When a tumor begins growing in the pancreas, it can interfere with enzyme production, which means your body starts failing to extract calories and nutrition from what you eat. You're consuming the same meals, but your digestive system is quietly starving. On top of that, the cancer itself creates inflammatory compounds called cytokines that accelerate muscle and fat breakdown. Here's the detail that trips people up. Plenty of things cause weight loss in seniors: medications, depression, dental problems, thyroid issues. So when the scale dips 5 or 6 pounds, most people rationalize it. But the medical threshold that should get your attention is this. If you've lost more than 5% of your body weight over a span of 6 to 12 months without deliberately trying to, that deserves a conversation with your doctor. Not next month, not at your annual physical, soon. If you weigh 170 pounds and you've dropped 8 or 9 pounds with no clear reason, pick up the phone. Weight loss is your body's alarm system. It doesn't always mean something terrible, but it always means something. Sign number 2, new-onset diabetes or sudden difficulty controlling blood sugar. This one surprises people. Most folks think of diabetes as a lifelong condition, something that develops gradually over years of diet and lifestyle choices. And that's true for the overwhelming majority of type 2 diabetes cases. But here's what many seniors and even some primary care physicians overlook. When a person over the age of 60 who has been metabolically healthy their entire life suddenly develops diabetes with no obvious risk factors, no family history, no significant weight gain, no dietary change, that new diagnosis can sometimes be the first detectable sign of a pancreatic tumor. The pancreas is where insulin is manufactured. Insulin is the hormone that regulates your blood sugar. A tumor growing inside the pancreas can damage or destroy the insulin-producing cells, called beta cells, which throws your blood sugar into chaos almost overnight. Researchers at institutions including the Mayo Clinic have studied this connection extensively and found that roughly 1 in 4 pancreatic cancer patients received a diabetes diagnosis within the 2 years preceding their cancer diagnosis. Now, if you've been managing type 2 diabetes for 15 or 20 years, this sign looks a little different for you. What you'd want to watch for is a sudden, unexplained worsening of your blood sugar control. Maybe your numbers have been stable on the same medication for a decade, and now, seemingly out of nowhere, your glucose readings are spiking. Your doctor increases your dose, adds a second medication, and things still aren't cooperating. That resistance, that abrupt shift, can be a red flag worth investigating further. The takeaway here isn't to panic if you've just been diagnosed with diabetes. The vast majority of new diabetes cases have nothing to do with cancer. The takeaway is that context matters. If the diagnosis doesn't make sense given your history, ask your doctor whether additional imaging might be appropriate. Sign number 3. Persistent, dull pain in your upper abdomen or mid-back. Many seniors live with some degree of back pain. Arthritis, degenerative disc disease, old injuries, the list is long and familiar. So when a new ache settles into the middle of your back, right between your shoulder blades, or camps out in your upper belly and refuses to leave, the instinct is to reach for ibuprofen and a heating pad. But pancreatic tumors, because of where the organ sits against the spine, can press directly on the network of nerves that runs behind it, called the celiac plexus. The pain this creates is distinctive in a few ways. It tends to be deep and gnawing rather than sharp. It often worsens after eating or when lying flat on your back, and it may improve slightly when you lean forward. Some patients describe it as a band of pressure wrapping from the front of the abdomen straight through to the back. What makes this sign particularly tricky in seniors is that it overlaps with so many other common conditions: gastritis, a peptic ulcer, gallstones, muscular strain. The key differentiator is persistence and progression. A pulled muscle improves in a week or two. Gallstone pain comes in acute attacks and then eases. Pain caused by a pancreatic tumor lingers. It doesn't resolve with over-the-counter treatment. It gradually intensifies over weeks. If you've had upper abdominal or mid-back pain that has persisted for more than 2 to 3 weeks without a clear explanation, and especially if it's accompanied by any of the other signs on this list, don't let anyone dismiss it as just part of aging. That phrase has cost lives. Sign number 4, jaundice, yellowing of the skin and eyes. This is one of the more visible signs, and in some ways, that makes it a blessing. Unlike internal pain or gradual weight loss, jaundice shows itself. You might notice it in the mirror one morning, a yellowish tint to the whites of your eyes. Your skin might take on a faint golden or even greenish hue, especially noticeable in natural light. Your urine may darken to the color of strong tea or even cola, and your stools may become unusually pale, almost clay-colored. Jaundice occurs when a substance called bilirubin builds up in your bloodstream. Bilirubin is a yellow pigment produced during the normal breakdown of old red blood cells. Ordinarily, your liver processes it, sends it through the bile duct, and it exits your body without incident. But when a tumor grows in the head of the pancreas, which is the section closest to the bile duct, it can physically compress or block that duct, trapping bilirubin in your blood. Tumors in the head of the pancreas account for roughly 60 to 70% of all pancreatic cancer cases, which is why jaundice is such a frequently reported symptom. And here's the critically important detail. Jaundice from a pancreatic head tumor can appear relatively early while the tumor is still small enough to be surgically operable. That makes it one of the warning signs most likely to lead to an early, potentially life-saving diagnosis, but only if you act on it promptly. Along with the color changes, many patients report intense, persistent itching across their entire body caused by bile salts accumulating under the skin. If you wake up one day with yellow eyes, dark urine, and skin that itches relentlessly for no apparent reason, do not wait. Get to your doctor that week. Mid-video engagement, 11:30-12. We're halfway through, and I want to pause here for just a moment. If you're over 60, or if you're watching this because someone you love is over 60, a parent, a spouse, a grandparent, this information could genuinely be life-saving. Pancreatic cancer thrives on silence and delay. Sharing what you've learned here, even casually over a phone call, even by sending this video to someone's inbox, can plant a seed that leads to an earlier doctor's visit and a better outcome. So if this has been valuable so far, take a second to hit that subscribe button and share this with someone who needs it. Now let's keep going. Sign number 5. Digestive problems that don't respond to typical treatments. You've started noticing that meals make you uncomfortable. Not in the way a spicy dish might bother you for an evening, but in a persistent, nagging pattern. Bloating after eating even small portions. A heavy, queasy feeling in your stomach that lingers for hours. Intermittent nausea, sometimes mild, sometimes strong enough that you push your plate away. Occasional bouts of diarrhea with stools that look greasy, float in the toilet bowl, and have an unusually foul smell. That last detail, the greasy floating stools, has a clinical name, steatorrhea. It happens when your body can't properly digest fats, which occurs when the pancreas isn't releasing enough digestive enzymes into your small intestine. A growing tumor can block the pancreatic duct, cutting off the flow of those enzymes, and the undigested fat passes straight through your system. Many seniors chalk these symptoms up to a sensitive stomach, lactose intolerance, irritable bowel syndrome, or simply getting older. And yes, digestive discomfort becomes more common with age for a dozen innocent reasons. But there's a pattern to watch for. When the bloating and nausea and loose stools start appearing together, when they intensify over a period of weeks, and when antacids and dietary changes don't seem to make a difference, your digestive system may be signaling something deeper than a food sensitivity. Keep a brief log if it helps. Write down when symptoms occur, what you ate, how long the discomfort lasted. Bring that log to your doctor. Concrete details make it easier for physicians to connect dots. Sign number 6. Sudden, unexplained blood clots. This is one of the lesser-known warning signs, and it catches many patients completely off guard. You develop a deep vein thrombosis, commonly called a DVT, in your leg. Your calf swells up, turns red, feels warm and tender to the touch. Or maybe it's a pulmonary embolism, a clot that travels to your lungs, causing sudden shortness of breath and chest pain. Your doctors treat the clot, but when they investigate why it formed in the first place, the usual suspects don't add up. You haven't been immobile, you haven't had recent surgery, you're not on any medication known to increase clotting risk. Cancers, including pancreatic cancer, can trigger a hypercoagulable state, a condition where your blood becomes abnormally prone to clotting. The tumor releases substances called procoagulants and inflammatory molecules that activate your clotting cascade. In fact, an unexplained blood clot is sometimes the very first clinical manifestation of an underlying pancreatic malignancy. The medical literature refers to this as Trousseau syndrome, named after the French physician Armand Trousseau, who described the connection back in the 1860s and who, in a tragic irony, later diagnosed himself with the same condition. For seniors who already face elevated baseline clotting risk due to age and reduced mobility, this sign can be maddeningly easy to attribute to other causes. The critical detail is the word unexplained. If a blood clot forms and your doctors cannot identify a clear reason, insist on further workup. A CT scan of the abdomen and pelvis is a reasonable next step and can reveal a pancreatic mass that might otherwise go undetected for months. Sign number 7. Sudden changes in mood, especially new-onset depression or anxiety. This might sound unusual on a list of cancer symptoms, but the research behind it is compelling and growing. Multiple studies have found that depression and anxiety can precede a pancreatic cancer diagnosis by months, sometimes appearing before any physical symptoms do. One study published in the journal Psycho-Oncology found that patients with pancreatic cancer were significantly more likely to have been diagnosed with depression in the year before their cancer was found compared to patients with other types of cancer. The biological explanation is still being fully mapped, but researchers believe it involves the immune system's response to the tumor. Pancreatic tumors produce inflammatory cytokines, those same molecules we mentioned earlier that contribute to weight loss, and these cytokines can cross into the brain and disrupt neurotransmitter function, particularly serotonin and dopamine. The result is a genuine biochemical shift in mood that the patient experiences as sadness, irritability, loss of interest in activities they used to enjoy, difficulty sleeping, or a persistent, unexplained sense of dread. For seniors who already face higher rates of depression due to isolation, loss of loved ones, and chronic illness, this signal can get buried under the assumption that it's situational. The red flag is suddenness. If someone who has been emotionally stable for years suddenly sinks into a depression that feels disproportionate to their circumstances, and especially if that mood change arrives alongside any physical symptom on this list, weight loss, back pain, digestive trouble, it's worth mentioning to a physician. The mind and the body are not separate systems, they communicate constantly, and sometimes depression is the body's earliest distress signal. Sign number 8. Loss of appetite and feeling full after eating very little. You sit down to dinner, a meal you've enjoyed 100 times, roasted chicken, mashed potatoes, green beans, and after 4 or 5 bites, you feel as if you've eaten a Thanksgiving feast. Your stomach feels stretched, heavy. The thought of taking another forkful makes you slightly nauseous, so you stop. And this happens again the next day, and the day after that. Over the course of a few weeks, your portions shrink to what a small child might eat, and even then, you feel uncomfortable. This phenomenon, clinically called early satiety, can occur when a pancreatic tumor grows large enough to press against the stomach or duodenum, the first section of the small intestine. The physical compression reduces the stomach's functional capacity. Simultaneously, the inflammatory chemicals released by the tumor can suppress appetite signals in the brain, creating a dual mechanism. Your stomach can't hold as much, and your brain doesn't want to eat anyway. The danger here is cyclical. Reduced appetite leads to reduced caloric intake, which leads to weight loss and muscle wasting, which weakens the immune system, which makes any future treatment harder for your body to tolerate. Patients who arrive at diagnosis already malnourished face steeper odds in surgery and chemotherapy. So take your appetite seriously. If your relationship with food has changed noticeably over a span of 2 to 3 weeks, if portions that used to satisfy you now feel impossible, bring it up. Don't assume it's a normal part of aging. Appetite is data. Listen to it. Let's pull everything together. 8 warning signs. Let me run through them one more time so they stay with you. 1. Unexplained weight loss. 2. New-onset diabetes or sudden loss of blood sugar control. 3. Persistent pain in the upper abdomen or mid-back. 4. Jaundice with yellowing eyes, dark urine, and pale stools. 5. Digestive problems, especially greasy stools and chronic bloating. 6. Unexplained blood clots. 7. Sudden depression or anxiety without a clear emotional cause. 8. Early satiety and loss of appetite. No single one of these signs by itself is a diagnosis. Each one has alternative explanations that are far more common and far less serious. A pulled muscle explains back pain most of the time. Stress explains weight loss most of the time. A bad week explains a dip in mood most of the time. That is exactly why this cancer gets away with so much. It hides behind the ordinary. The pattern is what matters. 2 or more of these signs appearing together, or one sign persisting stubbornly despite treatment, or a symptom arriving suddenly in someone who has been otherwise healthy. These are the moments that warrant action, not panic, action, a phone call, an appointment, a conversation with your doctor where you say, "I've noticed these changes, and I'd like to rule out something serious." You are your own best advocate. No one knows your body the way you do. No algorithm, no annual screening, no blood test replaces the instinct that tells you something feels different. Trust that instinct. Voice it. Insist on being heard. And to those of you watching this not for yourselves but for someone you love, a mother, a father, an aging spouse, your vigilance matters enormously. You notice the weight loss they're minimizing. You see the yellow tint they haven't looked for. You hear the fork being set down after 3 bites. Sometimes the most loving thing you can do is say, "I think we should get this checked out," and then drive them to the appointment yourself. Pancreatic cancer is formidable. Nobody will pretend otherwise. But early detection changes outcomes. Surgical options exist for tumors caught in their earliest stages. Treatment protocols are advancing every single year. The gap between a late diagnosis and an early one can be measured in years of life, years spent with grandchildren, years spent in the garden, years spent doing the things that make your life yours. So take this information and hold on to it. Write the signs down on a notepad by your phone if that helps. Mention them to your doctor at your next visit. Share this video with a friend your age, a sibling, a neighbor. Knowledge moves through communities one conversation at a time, and every conversation has the potential to save someone who would otherwise have waited too long. Thank you for spending this time with me today. If you found value in this, hit that subscribe button so you don't miss future videos. We cover senior health topics every single week, always with the same goal: giving you the information you need to live longer, stronger, and more informed. Drop a comment below and tell me which sign surprised you the most, or share your own experience if you're comfortable. Your story might be the one that convinces someone else to make that appointment. Take care of yourselves. You've earned every good year ahead of you. Go out there and protect them.